Irnos significa dejar a miles, a veces a millones de personas sin atención médica.
The soul of the people has been destroyed.
فكنت أتمنى الموت ولا العيش هذه الحمد لله.
We've seen it over and over and over.
إصابتي في يدي اليمين صار اطلاق ناري اشتباك وأنا في منطقة عملي فاجتني طلقتين متفجرة في يدي طلقتين متفجرة في يدي وراح العظم المفصل ما في مفصل فسويت 3 عمليات في اليمن ما فادت ما كان في فائدة ظروف الحال يعني البلاد وعلى حال البلاد ما قدرت أن أفعل العملية اللي هي مضبوطة فالله رزقني من منظمة أطباء بلا حدود طلعت من اليمن وسووا لي أول عملية.
Después de años de conflicto en un sitio como Yemen, las poblaciones están acostumbradas tristemente a la violencia que se está produciendo, que los bombardeos se sucedían en estructuras también civiles, en mercados, en puntos de agua, en carreteras, en puentes. Entonces, todo aquel o aquella que viviera en el norte de Yemen en esa época sentía esa vulnerabilidad de escuchas un avión y no sabes si va a bombardearte a ti, a tu pueblo, a tu casa o al puente que tienes al lado. En el momento en el que se bombardea también un hospital, te das cuenta de que ya no estás a salvo en ningún sitio.
If we continue to see this systematic pattern of attacks against healthcare facilities, against civilians as well in areas of armed conflict, then the consequences for the local populations living in these areas and suffering the effects of war is going to be immense.
We've seen this in Sudan, we've seen it in Gaza, we've seen it in other parts of the world. The immediate impact is very clear. So it's more casualties, whether we're talking about people getting killed or getting injured, but also we're talking about lack of access to health, usually for normal preventable diseases, for example, like vaccination services for kids or antenatal care services for pregnant women. Then normal deliveries or even cesarean sections and life-saving surgeries. All these services will be cut off, the population will be cut off from these services. Also, we lose the access to chronic disease medications and chronic disease management like diabetes, hypertension, asthma, epilepsy, mental health cases, even HIV, TB, for example. And that has a very important and difficult consequences on the long term on the impact of these diseases on population in the future.
أنا عندي طفل عمره 11 سنة يعاني من إعاقة ما يدخل الحمام. أنا كنت أدخله أثرت على حاجات نفسيتي أثرت على حاجات كثير فكنت أتمنى الموت ولا العيش هذه الحمد لله. بس بعد ما أنا صابت صرت ما أدري أروح ولا أروح بنفسي أروح أدور رزقه ما أدور رزقه يعني أنا تعوقت وهو تعوق الحال يتعب شوية كذا.
But why does it happen when it seems so absurd and it seems like this is a protection that should really be sacred? In a time of war, it can happen for a lot of different reasons. It might be purely economic, it might be for looting reasons. because people are desperate and hungry and they need supplies, they want to resell them. Maybe one of the fighting sides needs the medical supplies to treat their combatants in another place. It could also be for reasons such as revenge, hatred. We've seen that in different contexts which are very polarized and very kind of emotional contexts. It might be for very strategic military reasons. For example, a hospital or a medical center might be in an area that needs to be taken by one of the fighting sides. So we want to attack it to make sure that no one's living and staying and working in this area. And then obviously it can be attacked as well because it's lost its medical neutrality. If maybe there is some kind of strategic military planning happening there, maybe there is a stock of weapons in there, then the hospital, the medical facility or medical staff can lose their protection in international law. The attack has to be proportional to the military objective and also precaution. So all precautionary measures have to be taken to reduce, minimize or eliminate the risk to civilians in the area.
Definitely the long-term impact is the most serious and the most difficult to replace. We are talking about the destruction of the infrastructure. And here we are talking about hospitals, clinics, laboratories, supply chain, warehouses, etc., etc. Those are very expensive investments. So that's one part. The other part is on the healthcare workers themselves and the workforce, which either injured or killed. And to be honest with you, now we have an increasing trend of killing healthcare workers, doctors, nurses, midwives, ambulance workers, and all that. So they are either killed, injured, and become out of the service itself, or they are forced to flee. And this brain drain is also a very dire impact, has a very important consequence on the long term, because we are taking long time to train these health workers and for them to gain the experience.
Yo creo que uno aprende cuando está en varios incidentes de la importancia de que los equipos estén seguros, de que tenemos que estar allí donde estamos mientras podamos, pero que luego hay un momento en el que hay que priorizar la seguridad del personal médico, porque si eso se ve afectado, entonces se termina todo. No podremos volver a restablecer servicios si nuestros equipos no están bien, si nuestros equipos se ven afectados, cosa que pasa cada vez más.
So the humanitarian notification system or deconfliction, it really consists of ensuring that the authorities in the area of armed conflict where humanitarian actors are working and providing assistance, ensuring that those authorities know where we are at any one time and ensure that our premises, our staff, the patients that we might be treating or beneficiaries are protected. MSF, in the context where it works, it communicates with all the different armed actors in the area. So you might have a state actor controlling an area, but in another area you'll have a non-state actor, you'll have other armed groups that might be the de facto authorities of that area. So with all this, is it really possible to still assume that mistakes can happen? Let's say that mistakes can always happen. We're human, and even drones and other equipment that is programmed, it's programmed by humans, and so it will have its fallacies. But when these types of attacks become so frequent that they are systematic again and again and form a pattern, we can no longer accept that this is a mistake.
حاليا يعني مش بأمان كثير مع الضرب الآن، شعوري جدا تعب، يعني أطفى كذا، بس عشان أروح لهم أنا بخير وفي حالة طيبة لازم إني أصبر، يوحشوني قوي.
We see the attacks continuing.
Ya no sale tan caro atacar una estructura sanitaria.
No se respeta absolutamente nada el derecho internacional humanitario.
And now we are on more than 600 days after I left my house.